Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Instruments to preserve humidity. Humidity is preserved if um, humidity is less than 50%, then it results in complete cessation of ciliary activity. So humidity should be preserved to prevent the cessation of ciliary activity. There are three instruments which can preserve humidity. 1. Heat and moisture exchanger or HME filter. This HME filter acts like a artificial nose and it will moisturize the air. Second, humidifiers. Humidifiers are of two types. There are heated humidifiers and non-heated humidifiers. Heated humidifiers might cause thermal injury. So we generally use non-heated humidifiers. Non-heated humidifiers will humidify maximum of 70%. 3. Nebulizers can also be used for humidification. Scavenging humidifiers. The actually instruments used to prevent humidity. If there is less than 50% of humidity, this will result in complete cessation of ciliary activity. There are three devices to preserve humidity: heat and moisture exchanger, which works as an artificial nose; humidifiers, which are of two types: heated humidifiers and non-heated humidifiers. Heated humidifiers will cause thermal injury, whereas non-heated humidifiers can be used, and these non-heated humidifiers maximum of 70%, whereas nebulizers are seen.
thank you and thank you for watching.